Welcome to the second information session for the Winnebago County Community Mental Health Board Program Year 2022 grant. All of the resources are available for the grant application process on the Winnebago County Mental Health's webpage, which is www.r1planning.org/WCMHB. I will first answer some of the scripted questions that were received by email, and then we will move into an open question and answer session. Anything that cannot be answered today due to needing maybe further clarification, we will send an email out to everyone who is on the call, or if it needs to be communicated more broadly to all of the members on the email update list. If you're not on the email update list, it would be a good idea to sign up for that so you can keep informed of future components of this process. That there's a sign up button also on the web page that was mentioned and linked in the chat. And I believe it might ask for your birthday, but you don't have to put it in. So some people use those marketing platforms to send you, little nice notifications on your birthday. We do have with us today Marianne Abadi, who is the Winnebago County Community Mental Health Board President, and certainly available to assist me today as we do our best to answer your questions. There was a question from the last session that we needed to clarify, so I will start with that, and then we'll move to some new questions that were received this week. Can an agency outside of Winnebago County who does not have a local advisory board, who would certainly be disqualified from being a lead applicant? The question was, could that type of agency be a collaborating agency on a grant? The Winnebago County Community Mental Health Board funding policy does not make any differentiation between lead organizations and collaborating organizations. Therefore, collaborators must comply with all requirements of the funding policy as if they were a lead applicant, even if the lead agency is the fiscal and administrative agent. The only exception to this is the 3-year in operations rule. In the funding policy, it states, the applicant must demonstrate sound business practices for a minimum of 3 years prior to submission of application, exceptions to be pre-approved by the Winnebago County Community Mental Health Board. At the December board meeting, consensus was reached by the board that for this funding cycle, any organization who does not meet the 3-year minimum threshold but otherwise meets all other criteria within the funding policy may be a collaborating or sub-awardee on a grant application, but would not be a lead applicant. This is the only exception for this funding cycle. The board will establish a learning network collaborative among funded partners. So anyone who is funded in this funding cycle, it is required that you participate in this learning collaborative, which it is anticipated that we will meet bi-monthly to share information about how implementation and evaluation components are working. It is our intention that we will learn from this and that we will improve the process. So certainly as we learn this year what additional gaps in the community might exist, we can consider improvements for future years, but at this point in time, that is the really the only exception that has been made to what otherwise should be taken very literally every component of the funding policy. Is there any need for additional clarification on that particular question? Okay. Was somebody going to respond? Okay. One note of an update that has been made, if you've already gotten so far in the grant application process that you're to the budget, good for you. There has been somebody that's made it that far and realized that the budget template had locked cells where you were supposed to enter a description on a few of the items. So I did unlock those cells and linked a new budget template that has those cells unlocked. So if you had previously, basically prior to yesterday, had downloaded a budget template and you were working in that and you find those cells locked, please go back in and re-click the link and download the new updated budget template. Question that was received by email. We would like to apply for funding under mental health services, case management, and family and community support. Would we include both programs under one application, or would we submit two separate applications? So in the grant portal, there are some, in the grant application itself in the grant portal, there's a little bit of instruction around this. And basically the idea is, if the priority areas that you're focusing on and the services that you'd be delivering under those priority areas are going to be integrated and coordinated, then complete one application for them. If they're not going to be integrated and coordinated and they're kind of separate in their operations, then you are able to complete separate applications, and we'd recommend that you do complete separate applications for them, since they would need to be judged independently of one another. So when you go in and you complete an application, you set up your organization, you can create an additional application. So if that's something that your organization needs to do based on the nature of the things you're applying for, and you're having any difficulties with that, again, please use the info@mentalhealth.wincoil.us, and we will walk you through any instructions that are needed for that. A good way to maybe a couple of questions to consider when you're asking, what does it really mean to have these priority areas integrated and coordinated with one another? I think a good question to ask is, will they be serving the same target population? Will they maybe be managed under the same project director or program director? That would probably be a good indication that they are integrated and coordinated. Will clients receiving one service be referred to the other services that you're applying for? And or will they be able to receive those other services? So if you have a target population that you're trying to reach and you're providing multiple services under multiple priority areas, all integrated, they're all connected, they're all under common staff, then certainly we would consider those integrated and coordinated services. Any need for clarification or any additional questions on that particular one? I know that's a little bit nuanced and not totally cut and dry.
I have a quick question on that, please.
Sure.
Would outcome measurements have any distinction in that? Like if there's two different programs that potentially integrate and coordinate, as you just mentioned, but we measure two different types of outcomes, would that suffice a second application, or could it still be one?
Well, even if the outcome measurements were different for the different priority areas, it could still be one, so long as the services are integrated and coordinated. The grant system that we're using will allow for different outcome measures for the different priorities. And so we could still measure unduplicated clients served, for example, that received one service, and then even if that same client received a different service, they would be unduplicated for that other service. So we do have a way of within one funded program to measure different services and different priority. Is that clear that up? for you?
Yes, it does. Thank you.
Okay. Will the grant be renewable for subsequent grant periods? So it is the intention of the board to renew funding for successful programs to maintain a community support program in Winnebago County, but this is not a guarantee in any way. And the decisions are going to be made on a year-by-year basis. So there will not be multi-year funding commitments made in this program year. What is the expected funding range or average grant award? I'll be honest, in my experience of having written grants in the past, I think that often when we see a grant maximum amount, then that becomes the amount everyone applies for. Maybe that's not a hard and fast rule, but that's not the intention, to create an amount that everyone applies for. So we really, there's no minimum amount or maximum amount. The total combined amount for all awards is $8.8 million. And, you know, two important considerations are that a community support system requires an array of services from multiple service providers. So certainly the board will be, in weighing applications, also weighing the total picture of making sure that all of the target populations are reached and that we are funding all of the priority areas, and making sure that there is a good balance of different sectors and different types of organizations represented. And secondly, within the grant evaluation rubric, organizational capacity and financial sustainability are considerations that will be considered in the actual grading or evaluating grant applications. So, you know, I think that's an important consideration for determining what maybe is a reasonable amount that your organization, based on its current budget, would be able to manage. If you're seeing an organization that operates on a, let's just say, $1 million a year budget, applying for a $1 million grant, that may not be, you know, weighed or graded well in terms of looking at organizational capacity to take on that much new revenue. May we submit partnership agreements with the application? Absolutely, you may. It's not necessary to do that, but collaboration is one of the grant evaluation considerations, part of the rubric. So partnership agreements, depending on their nature, could be beneficial to demonstrating that collaboration and documenting in a very formal way what that collaboration will look like. That particular type of form could be submitted under the evidence of length and time and existence tab. So in addition to providing, let's say, your articles of incorporation, if there's multiple agencies collaborating on the grant, then you could also include, for example, a collaboration agreement with your, as the lead agency, your articles of incorporation, and then those collaboration agreements, you would need to, I believe, combine those in one PDF. Kristen, do you know if that's the case for submitting documents?
I can have a look at the application and check back with you.
Okay, yeah, we can maybe clarify that, if anybody's having issues with that, let us know. But I think that for some of the uploads, you'll have to combine things into one PDF if you're using multiple forms that need to be submitted under one upload station, so to speak. Okay. Okay, we have a few questions in the chat box, so let me take a look at these. Regarding the budget, can coverage of transportation and medication co-pays be listed in the budget to decrease transportation and financial barriers? So transportation itself is a service area under the client outreach and identification priority area, and that's priority number 5 in the strategic plan, which will be included in next year's funding cycle, but not this year because we do not have a full year of funding. We cannot fund all of the priorities this year. There'll be 2 additional priority areas next year. So I'll add that clarification, but if there are components of, well, medication copays, that, depending on the nature of your program and the gaps that you're trying to meet and the evidence that you're providing, medication management is one of the service areas under the priority of mental health treatment. So, I think that it would probably be appropriate to include under that particular service area if you're applying for that. But of course, there'd need to be sufficient support to demonstrate why that is needed and not being covered by another source. Can an organization collaborate with more than one community partner and submit more than one application as either the lead or co-collaborator? Sorry, let me read that one again. Can organizations collaborate with more than one community partner and submit more than one application as lead or co-collaborator? Yeah, there's not any particular, there's no limit to it. Within reason, if you're just jumping on board to every application in town, good for you, first of all, for having those type of networking skills. But yeah, if you provide a unique service that connects with multiple other organizations, but again, I think the key consideration here is what is your organization's capacity, and if you're on multiple applications that are awarded, and I think, in addition to considering individual applications, the board will be considering kind of the entire system as it's being funded, and will need to consider organizational capacity also as it relates to agencies who are applying for multiple awards.
Jason, is
Yes.
this, Mary Ann, is this the time that would be helpful to explain the collaboration and the expenses, the budget that possibly they each would have to, if they reach a certain level, they would have to submit individual budgets?
Yeah, so on the budget, if you're applying, if there's multiple collaborators on a single application, then we are asking if there is on the budget template, a line item for subcontracts. The intention of that is really more or less meant to be a single organization that's subcontracting out a particular service. For example, just going to throw out this example. This is not in any way meant to be being proposed as something that should be applied for, but some mental health treatment centers might use a psychiatrist that they subcontract rather than bringing on as an employee. And so that would be appropriate to put in the subcontract line. But if you're doing a collaboration with multiple partners, there should be a separate budget from each partner organization. And if it's just 2 agencies that are involved, I think if the subcontracting amount is more than 10% of the whole budget, then we would appreciate having a separate budget so we can ensure that the expenses, such as, there aren't hidden cost in that subcontract amount that's going to indirect expenses and administrative rather than direct service for the partnering agency. Okay, well, we can certainly take additional questions. Have those of you that have been looking at the strategic plan found the target populations and priority areas to be clear?
I do have a question, please.
Yes.
I noticed the list of agencies that are not eligible for funding. Are they eligible to be a partner collaborative on, can they be written in as a collaborative on an application that we submit?
No, the disqualifications list, those are agencies that due to an affiliation with a member of the mental health board are disqualified, and that is based on the state law, Community Mental Health Act, as well as the board's bylaws, and that has been clarified, and they are not allowed to apply as a lead agency or a collaborator. So if any organizations find themselves in that category and had the intent to apply, it is recommended that you would reach out to the board member with whom you are affiliated to make that intention known, so that board member could make the appropriate decision that is needed to eliminate affiliation as deemed appropriate.
Thank you. And just to follow up to that, understanding that they're not eligible for funding, if they are somebody that makes the application stronger because there's a relationship there in terms of referrals back and forth or whatever, may strengthen the application, can they be included in it if they're willing to without any funding?
Yes, they can be included as a collaborator. They can just not receive funding from the mental health board.
Okay, thank you.
Any other questions?
One other comment I'd make, that if questions come up after our information meeting, certainly you can email you actually have that site up so that people would know where to.
Yeah, yep, the email address, the info@mentalhealth.wincoil.us is, you can find that. And all of the email updates that we've been sending out also in the chat box. So please look at that. The link to the website's in the chat box. And then the link to subscribe for email updates is also in the chat box. So I know it's early in the process. So you're probably still reviewing things, probably still wrapping your mind around what you might apply for. And I know that additional questions will come up. So please feel free to send those emails as they come about. Okay, well, if there's no additional questions, then we will end today's session and seek those follow-up questions through email. All right, well, thank you very much for attending today.
Thank you. Thank you.
Thank you all.
Thank you.